Good evening. This is Dr. Indu. I'm a consultant dermatologist and aesthetic surgeon in New Delhi, and I'm here to share some issues and myths and answer all your questions related to skin and hair during this lockdown. So now COVID is there, lockdown is there. So why we're talking on skin and hair? So I'll be telling you something before I start about this lockdown. See, I know that you must be taking a very good care about yourself, being very safe at your home, not going out. But then use this lockdown, spend time with your near and dear ones, with whom you were not able to spend time because of the time lag, because of the busy schedule. Second is you do constructive and productive things like which you were not able to do before because of the again the busy schedule. So do whatever you wanted to do, your hobbies, you want to paint and dance. Just keep yourself engaged and happy in something you always wanted to do, and not something which is trending, like the challenges trending on the Facebook, the Dalgona coffee. Yeah, I know. And third is, after this lockdown, you have again to face the world again, and work will continue. So keep yourself updating with the knowledge in your fields. Keep doing your homework, your work from home, and just don't waste time like anything. So now why skin and hair? Because we all are left at our homes with ourselves, and we are digitally everywhere now, and for all our doubts and concerns, we are now consulting Dr. Google, and Dr. Google is always non-defeatable. So let's have something which is evidence-based, which is scientifically proven, and whatever treatment and suggestions that I'm going to give you right now regarding your skin and hair are all based on some scientific studies and documentations. So I'll be starting with the issues regarding your skin and hair. So first, about the coronavirus, all the doctors worldwide, they are updating us regularly regarding the rashes they are seeing, which are directly seen in the patients who are suffering from coronavirus. And so there are few rashes which are being reported in the patients who are suffering from this viral disease. Unlike all the viral diseases, this can also manifest with few rashes, skin rashes, and skin rashes like red erythema, which are non-itchy, subsiding by its own, that may appear on your trunk mainly. And you can also get these wheals on your body, which subsides after some time. So rarely you can get a cyanosis, painful cyanosis at your toes, and bruises and petechiae on your body. So this was just to make you aware about the rashes which can appear in this coronaviral period. And so now I'll be starting with the issues which I'm commonly facing from my patients and people who are there at their home lockdown. So the first is the hair loss. Most of the people, I'll be coming to all your questions. First, I'll be dealing with, I'll be dividing this talk in 3 parts. First, I'll tell you about the issues that we commonly suffer, which the patients now are concerned about. Second, I'll be dealing with the common doubts or common myths which are associated with the skin and hair problems. And third, I'll be dealing with all your comments and questions. So hair fall, first of all, let me tell you why hair fall occurs. See, our hair has a growth cycle. Now this growth cycle has 3 phases. It is ACT, that is Anagen, Catagen and Telogen phase. Now when your hair is in the Anagen phase, it grows. In Catagen phase, there is a resting phase, and in Telogen phase, your hair falls down. Now 50 to 100 hair falling each day is very normal. Because if the hair in the Telogen phase won't fall down, the new hair from the Anagen phase won't come. So 50 to 100 hair falling every day is very normal. But again, the loss of hair falling down, it really concerns you. And nowadays, because of our lifestyle, because of the stress, because of the diet we are taking, the age at which the hair fall has to occur is reduced. So So the most important cause for our hair loss, that is androgenetic alopecia. Now androgenic alopecia is two types, that is male pattern hair loss and female pattern hair loss. What happens is your testosterone is converted into dihydrotestosterone. Now this dihydrotestosterone acts on your hair on the frontal part. It doesn't act so much on the back hair and on the beard hair, but the frontal hair are very much prone to this. So what happens, due to this dihydrotestosterone, you get the hair loss. There is miniaturization, that is the thinning of the hair root, which ultimately makes it fall down. Now, what is the treatment for that? For hormonal alopecia, we have some medical treatment and some procedural treatment. In medical treatment, we do have Finasteride. Now, Finasteride is the medicine which inhibits the conversion of your testosterone to dihydrotestosterone, and that is the way it works. Second is Minoxidil, and third are the growth factors. Now there are a lot of concerns regarding Finasteride, that Finasteride causes your loss of libido, and there are so much about it on the Google. People are really scared of taking Finasteride, which I totally understand. So there is a topical form of Finasteride which you can apply over the scalp. But obviously, the oral form of Finasteride is more efficacious and more effective than the topical form. Then comes your Minoxidil. Now, Minoxidil is again having a lot of dilemma in people, especially the youngsters. They are very skeptical about taking Minoxidil because they think that Minoxidil causes more hair loss, and reverse it, when you leave it, your hair will fall more. So it is not like that. The hair which falls down after taking Minoxidil is the hair which has to fall down, and the new hair has to come at that place. So some hair loss after Minoxidil is normal, and you cannot judge the action of Minoxidil after 2 weeks or 3 weeks, that it is acting or it is not acting. You need to take it like for 6 months at least. So that was about the medical treatment for your hair loss. Now what about the advanced treatments? In advanced treatments, we do have growth factors, and it's better to have growth factors which are from your own body. Now from your body, from where? So growth factors from your blood, that is the platelet-rich plasma, which is PRP. Growth factors from your fat, that is your nano-fat injections. So what we do, that we take your blood, we kind of process it and filter it and inject the growth factors over your scalp. Same way in the fat, these procedures are very minimally invasive, they are harmless, and it's your own growth factors which are being injected on your scalp. So this is about the treatment for hair loss. Now many people ask me that what is the correct time for taking the treatment for hair fall. So for them, see, earlier you treat it, better is the result. Otherwise, more and more miniaturization or more and more thinning and absence of the roots occur. Now because of the more and more thinning and absence of the roots, the more you advance, the greater are the chances of getting baldness. Now what is baldness? Baldness is the situation where you won't have even the thin hair, your roots are absent. So these all medicines and even the PRP, platelet-rich plasma, don't work there, and you have to go for hair transplantation. Now hair transplantation, yes, good evening Ruby Das, Bipin Patel, yes, hello, hi. So what is hair transplantation? I'll brief you a bit about that. See, what happens in hair transplantation is that your hair from the behind of your scalp and your beard is taken through FUE, which is follicular unit extraction, which is very painless and very minimally invasive, and that hair is implanted in your bald area. Now the slits are made in your bald area, and that hair is implanted in the slits. Now there are a lot of doubts that hair transplantation is dangerous, and there are a lot of side effects, but no. Although it is a technical procedure, it requires expertise, but then if it is done by an expert dermatologist or an expert plastic surgeon, it is very safe and it is very effective. But then again, once you start hair transplantation at the earlier time again, then it is better, because with age your quality of the roots of the hair also decreases, And with age, as your baldness increases, the area of the donor hair also decreases. So it's always better to get an early treatment. Many females do come and ask that, yeah, her son is young and he doesn't need any treatment like PRP or like medical treatment. No, if you wait, the situation is going to worse. Now the third thing in hair loss is your telogen effluvium. See, I told you about the cycle of hair loss. So in the telogen cycle, what happens when the hair falls? They do fall in lot of number. So if you had some stress factor 3 or 2 months ago, if you were ill, if you were on the crash diet, you are supposed to get these hair loss after 2 to 3 months. And this hair loss occurs because all of your hair has come in telogen cycle. So they are falling in all together and you almost feel like now they are going to get bald. So that is not the case. Telogen effluvium is reversible. Even if you don't take any medicine, it is going to reverse back. So you need not get stressed because, yeah, mind it, stress increases your hair loss. So telogen effluvium is a very concerning situation nowadays among people. So hair loss, apart from your hormonal causes and apart from your telogen effluvium, it's nutritional as well, and other kind of hormones like your thyroid hormone. If you have thyroid imbalance, you may have hair fall. If you have PCOS, that is polycystic ovarian syndrome, you can have hair loss. So hair loss altogether needs your assessment of the scalp, assessment of your hair, and assessment of your hormones as well. So after hair loss, I have a lot of patients who are calling me now for their acne. Now they are breaking out, season is changing, now summer is also coming, and a lot of patients are getting these pus field lesions. So for acne, you must know why acne is occurring. See, what happens, our face has a lot of sweat glands and a lot of oil glands. So these oil glands, what happens is after because of some hormonal action or because of your diet, your lifestyle, or whatever, these hormones cause the clogging of your glands with the oil and with the bacteria. Now the secretions and bacteria, they kind of clog or obstruct the opening of your glands, which causes the inflammation and acne. So now this what happens when you get a pus filled. Now acne has a lot of it's a huge amount list of the treatments. So it can be treated by oral treatment, by the topical treatment, chemical peels, and lasers. So to begin with, you must know that you are having acne because of the oil secretion. So you must take care of this by a proper face wash according to your skin type. Now because you are oily, you are having this more acne prone skin, so you must use a face wash which has salicylic acid or glycolic acid in it. Again, moisturizer, you must take care that your moisturizer contains humectants or gel based or water based substance. It's not greasy or it's not oily, otherwise it will increase your acne. And third comes when you have the pus field acne, you must take antibiotics on the consultation with the doctor, your dermatologist, and topical clindamycin. Then for maintenance, you have to take benzoyl peroxide and adapalene throughout. Again, acne treatment has to be done under the supervision of a dermatologist, and there are now various advances. There are special peels which take care of your acne. There are special lasers which take care of your acne. So for that, you can consult your dermatologist. Now the third issue is which many people are calling me now is pigmentation. See, I have made a complete video on pigmentation. I hope you go and watch it. Pigmentation is very depressing in our scenario, and it can be of various types, various causes. It can be patchy, it can be diffuse. So it's very important that once you get a pigmentation, you go to your dermatologist, you get it assessed that what the cause of your pigmentation is, till what depth it is there, and what is the best treatment for you. Now, pigmentation can start from melasma and it can go to PDLs. Melasma, mostly some people are genetically prone to get these pigmentations on their face. They inherit from their family, and you cannot do much about preventing that. But then, yeah, once you get it, you must get it treated, and initially you must get it aggressively treated by chemical peels, by phenolic peels, and later on you can maintain yourself with the topical creams. Now, for pigmentation, it's very important for you to understand that sunscreen is very important, and it's also very important for you to know that which type of sunscreen is suiting you and what is the proper method of applying the sunscreen and the frequency of applying the sunscreen. So if you are having oily skin, you must go for gel-based or water-based sunscreen, and if you are having kind of very dry skin, you can go for the cream-based of sunscreens. Sunscreen has to be applied like 2 finger units. It must be applied on your entire face uniformly and half an hour before you go out. Now, there's you are locked down, you are inside your home, so you should apply the sunscreen or not. That's a very big question. But people, guys, you have to understand that even your home has your UV radiations. You are using constantly in the kitchen, you are using your laptop, your phones, there are infrared radiations, so everything is going to affect your skin. So not 2 hourly or 3 hourly or 4 hourly, but at least once a day you must apply the sunscreen even if you are at home. So this was about melasma. Now secondly, I will be dealing with the periorbital pigmentation, which most of the, especially females, they are concerned about the periorbital pigmentation. See, what are the causes of periorbital pigmentation? You must be aware about that first, because periorbital pigmentation is a very complex area of interest. What happens? The skin around your eyes, they are the thinnest skin in our body. So what happens when we are constantly blinking our eyes, when we are constantly on the computer, there is a lot of activity happening in the skin around our eyes, which is leading to, kind of destruction to the elastic fibers and the collagen fibers. Also, because of lot of activity, because of lot of use of the muscle over there, it is kind of creating atrophy to the muscle as well. So what is happening is the pigmentation per se is not a pigmentation, but it's because of the skin changes and the collagen changes that you can see the shade around your eyes. Also, what happens, the fat around our eyes, with aging, the fat kind of falls down. So because of that, there is a hollowness around your eyes, and that hollowness is visible as a shade or a hypopigmentation. So guys, if you have pigmentation around your eyes, it can also occur because of the sugar resistant acanthosis nigricans, that is sugar intolerance, and dryness of skin, that is atrophy. Even these are the factors which cause your periorbital pigmentation. Now once you have periorbital pigmentation, depending on which cause is actually causing your periorbital pigmentation, the treatment also varies. In dermatology, in skin and hair, there is no one generalized treatment which is applicable for everybody. Everyone has different treatment, everyone has different kind of lesion, different cause of lesion, and different type of skin as well. So the treatment varies. So yeah, I am getting a lot of questions now. I'll be addressing this. Sure, I'll be dealing with all the questions once I'm done with the issues and the myths of my patients. And I think whatever I'm telling you, all the issues and all the myths, they're going to kind of tackle all your 80 to 90% of questions, and then I'll come to the questions. Yeah. So I was telling you about the periorbital pigmentation treatment. See, it starts from very mild kind of peels like arginine peel or mandelic peels. It can go to the fillers, because if you have fat descent around your eyes, the hollowness is leading to what the pigmentation you are seeing, and in that case, hyaluronic acid fillers are there, which kind of fills your tear trough and kind of makes it fresh and not dull. And other kind of treatments can be your topical creams you can apply for your periorbital pigmentation. They also work very good, but the response is very slow. So the laser toning, like we have laser toning for periorbital pigmentation, and the response is very good. It is also non-invasive. Even your fillers, they are natural products, they are not hazardous, and they give a very beautiful and natural result to your skin. Now, the other kind of pigmentation that you can get are very resistant kind of pigmentation on your cheeks, that is acanthosis nigricans. It can be your deep dermal pigmentation. The pigmentation on your forehead can be because of your dye, because of the allergy in the PPD in your dye. It can cause your forehead pigmentation. Your periorbital pigmentation, and the pigmentation around your eyes and the lateral areas and near your angle of mouth, this can be pigmentary demarcation lines. So these need kind of a strong treatment in the form of chemical peels and in the form of laser, that is Nd:YAG Q-switch lasers. So I think this is about your pigments. The third kind of concern is acne scars. Now people, if you have acne, you just ignore it thinking that yeah, it's just a pimple and it will go on its own. This is our normal belief that acne comes and goes. But if you don't treat your acne aggressively in the first go, what will happen the second time it will happen, it will create your pigmentation and it will create scarring in the same area, and then it becomes very difficult to treat those scars. But then of course there are treatment for your scars as well. Like it again depends on the level of your scars and the type of your scars, but we have a lot of treatments for your scarring. So for scarring we have subcision. Subcision is nothing but it's breaking the bonds below, breaking the fibers and the collagen fibrosis below your scars using the needle. It can be combined with radio frequency subcision, which gives a very beautiful result for that. Nowadays we have nanofat injections, which also and PRP injections, which kind of leads to collagen remodeling below your scars and give very beautiful results. So again, micro needling is there. Now micro needling, again there are a lot of confusion among the patients. They think that they can buy the derma roller and kind of do micro needling themselves because it gives glow and rejuvenation and takes care of your scars. No, it's very dangerous because you don't know how much deep you have to go. You can get pigmentation after that, you can get serious infections after that as well. So if you have scars, it has to be tackled at the very early stage. Don't neglect your acne thinking that it will go on your own. No, it will go, but then it will lead in pigmentation and scarring on your face. So I think I have dealt with the most common conditions. What people are mostly concerned, since it is a lockdown and there are no maids at your homes, so most of the kitchen work and most of the household works are supposed to be done by us, and including me. A lot of patients, a lot of people are getting this hand eczema, dermatitis on their hands. The season is changing, so a lot of dryness on the skin is happening. So guys, you need to understand this, that for this eczema, it's very important that you know that your skin has a lot of layers, and the topmost layer, that is the stratum corneum, it gets denuded by the environmental factors and kind of flakes from your skin. So once it flakes, what happens? The water from inside of the skin comes out, and the infection or bacteria or the allergic material from outside goes in. So once you don't stabilize this topmost layer of your skin, you are going to get all these rashes and infections coming up. So you need to know that you have to apply a moisturizer daily, irrespective of your skin climate, irrespective of the you have rashes or not have rashes. You must apply a sunscreen. Yes, it depends on your skin type a bit and the climate also a bit, but then the moisturizer has to be applied. If it is summer, you can go for thin moisturizers which don't grease your skin or sweat a lot, and if it is kind of cooler climate, you should go for the thicker moisturizers. Now since you have taken care of your dryness as well, the household works what you are doing in your kitchen, and you are getting the hand eczema. For that, after you wash your hand, or after you do any kind of work, you apply a very thick moisturizer on your hand. Don't apply just coconut oil or just thin moisturizer, because you need a very strong barrier for that. And use gloves before you do all the vegetable cuttings and washing your utensils. Now I'll tell you something about the infections, because summer is coming and we're sweating a lot. The fungal infections are going to now increase. Here what I would like to say, see, all the rashes are different. The causes of all the rashes are different. It can be because of fungus, it can be because of bacteria, it can be just eczema. So unless and until you are clear that what kind of rash you have, you cannot decide what treatment you are going to get. And mind it, when you go to the pharmacist and tell the pharmacist that, see, I've got this rash, give me a cream, the pharmacist will very confidently tell you, yeah, you have got this rash, that this cream will work beautifully in this, and you take it. But people, all these creams contain steroids, and steroids are having very much hazardous side effects on our body. Steroids have categories. It starts from highly potent to a very mild kind of steroids. If you apply very high potent steroid on your face, it's going to burn your face literally. So, and if you apply steroids on your fungal infection, it's going to increase it. And then you come with us with all the stria and all the burning and all the things. So please don't self-medicate. This is the time of utilizing the digital platform. We are there everywhere. We are at Facebook, at WhatsApp, at Instagram. You just have to search your dermatologist, call him or her, contact her through comments, through messages, and get the prescription, and then go to the pharmacist and get the treatment. So that is the right way of approaching any kind of your skin or hair issue. Now I'll be telling you about, since we are at home, we are kind of, seeing ourselves in the mirror a lot. So we are seeing a kind of wrinkle coming here, and our jaw looking not proper, or something with our eyebrows. And because we have a lot of time to think about ourselves. So of course, it's good to think about yourself, and it's good to be taking care of yourself. But then everything provided on Google and on YouTube, you should be skeptical of trusting everything, because everything related to your health has to be scientifically based. And here I would like to tell you what is the definition of health. Health is nothing but it's physical, and mental and social well-being. It is the definition of World Health Organization, that is WHO. So if you are not socially and mentally okay, you are not healthy. It's not just your physical thing. So if something is bothering you mentally, you are not healthy. So in that case, you should go actually after the lockdown, but then you can gain a lot of knowledge at this time about your aging process, about the enhancement procedures on your face, about the glow of the skin, because a lot of advances have come, a lot of newer technologies and newer treatments have come, which can make you more confident and beautiful in your own way. And aesthetics is all about feeling confident, so that you can give the best output of yourself in the society, in your workplace, and you can get the best feeling of about yourself as well. So I'll be now taking the questions which were bombarded to me since I've started my practice, and I'll be addressing all of them. I hope that it addresses your questions as well. I'll come to your all comments one by one, definitely sure. So there is first question which says, does shampoo lead to hair fall? No, it is a myth. See, your shampoo depends on the type of scalp you have. If you have a very oily scalp, you might end up doing shampoo daily, which is very much okay, because your scalp is very oily, it's greasy. You need to remove that grease and that dirt from your scalp. Shampoo doesn't lead to hair fall. Shampoo can lead to dryness of your hair. The cuticle of your hair, it may become dry and may be taken care of by conditioner after you shampoo your hair. So that is a myth. Now the second question is, hair transplantation is a big surgery and leads to brain injury. No, hair transplantation is a very technical kind of surgery. Yes, agreed. But then if done by an expert, if done by a dermatologist and plastic surgeon who knows about the procedure pretty well and is have got the training in that, it's very safe and very painless and very rewarding. Like the result, it boosts your energy, your confidence, like anything. So what is the best age of treating acne? I think I have addressed this. The moment you see an acne on your face, you must treat it. Treating hair loss too early is not good. No, if you leave your hair falling like that, the roots will become less, and then you will probably need more sessions of PRP, and you may land up getting bald. So that is not good. Get early treatment. Chemical peels are dangerous. Now about chemical peels, many people, patients with low of pigmentation and actual requirement of chemical peels, they will come and they'll say, just give me some natural treatment or give me some cream to apply. I don't want the chemical peel. I don't want the side effects. See, the creams what we are going to give you, they are not going to give you that instant result because they take a lot of time to act. So chemical peels are safe in the sense because there are a lot of types of chemical peels which act at different levels of your skin. Now, if it is a lactic acid or if it is a mild percentage of the glycolic acid, it acts at the superficial level of your skin. If it is trichloroacetic acid, which with a higher percentage or a higher percentage of salicylic acid or a higher percentage of glycolic acid, it is then going to go deep. Now it's the dermatologist's call to decide that how much depth peel you actually require and how many sessions you require. So if it is done that way, decide, taking consideration your depth and the type of the pigment, it gives beautiful results which creams cannot give. Creams are after these peels for your maintenance, for the maintenance therapy of your, or before the peels for the priming of your pigmentation. So yeah, chemical peels are not dangerous. Natural exfoliators are better than applying creams. No, never. See, I know that nature calls us and we are very much fond of the natural products, but mind it guys, I have seen a lot of patients who come with lot of allergy with all this basin and all the products that they use. They make paste and exfoliate, and if you are having a dry skin and you kind of exfoliate your skin with all these products, you are kind of rubbing your skin a lot, and that rubbing leads to pigmentation. So you land up getting pigmentation, you land up getting lot of allergy, and which is not good. So natural exfoliators is no. Razor causes increase in hair growth and thick hair. Again, it's a very big myth. I know when you go to the salon and get your underarms, they say, oh, you are using razors, that is why you are getting the thick hair. No, see, razors act on the superficial part of our hair. It doesn't reach our root or the bulb of the hair. So it has nothing to do with the thickness and the growth of the hair. It just removes your upper part of the hair that is visible to you, and that is pretty safe. And during this lockdown, when all the salons are closed, I think you are dependent on razor. And one more thing which people ask about the split ends on the hair, because now again I'm getting a lot of calls that salons are closed, they're not getting the hair cut. You can grab a scissor and get rid of your split ends by yourself. That is the only way. At the home, we don't need sunscreen. I think I've addressed this. You definitely need sunscreen because UV radiations is there at home as well. I'm losing 1,000 hair per day. Will I get bald? See, if you're losing 1,000 hairs per day, maybe you are having telogen effluvium or androgenetic alopecia or some systemic cause which needs to be, assessed. So that is the time you call the dermatologist, get it assessed and get treated. There is no need to take stress. Anti-aging treatments are surgical and harmful. I know it's a very interesting question. Anti-aging treatments, see, I told you why we age. It's very important for you to know that why we are aging. What is happening is with age, This muscle, our facial muscles, are the most active muscles of our body because of so much of facial expressions that we daily basis we make. And with age, what happens? The fat what we have, it settles down with gravity and sags. So there is sagging of the face which needs to be lifted or enhanced with anti-aging process. Also what happens in aging is the collagen fibers below your skin, they kind of degenerate or break down with aging, and you get these wrinkles around your eyes, on the forehead and everywhere. So these are the reasons why you are aging. Plus, to add on this, the pollution and the lifestyle and the diet and the sleep and so many things. And to mind you, the smoking and addiction as well. Smoking accelerates your aging like nothing. So not only aging, it causes hair fall, it causes the breakouts, and everything is related to smoking. So this is how you age. And if you are aging that way and you are trying to take care of that by minimal products which are natural, which are restoring your natural look, it's not at all dangerous and it's not at all surgery. So anti-aging treatments are not surgical. It consists of the fillers and the toxins. Now what are fillers? Fillers are nothing but the hyaluronic acid. Hyaluronic acid is anyways present inside our skin. Below the skin we have mucopolysaccharides which contains hyaluronic acid. Now these hyaluronic acids are synthesized and they are kind of injected over your cheeks to lift it, around your eyes to make it look fresh, around in your chin if you are worried about your short face and about your short chin, about your around your jawline. So these techniques, if they are done by the experts, by aesthetic physicians or aesthetic surgeons, they are very safe and they don't have that complications that you are scared of. And the toxins are hardly injected in your skin. It's very superficial. It's just in your dermis. So they are not going inside as well. So how can it be a surgery? So they lead to the side effects or complications only when they are not done properly in proper hands. So the other thing is, fillers and Botox are big invasive treatments and they make you look like duck and funny. I know this question arises because you see these celebrities with those faces and the trolling. See, this occur only when it is overdone, when you have too much of expectations out of the aesthetic procedures, and if it is not done by a proper dermatologist or aesthetic physician or cosmetologist who has a proper training in that. So you should never have an expectation which is too much. These procedures are meant to restore your natural look, to restore your identity and make look you more confident and more fresh. So they don't normally go wrong if they are done properly and if they are done at the required level. If they are overdone, then only they make you look funny and look like a duck. Now, natural treatments treat pigment better than the medicines. There are a lot of videos I recently watched on the natural remedies of treating pigment and this and that. See, pigment is not that easy that it can be treated by your natural products, first of all. And second of all, nothing is natural. Whatever you are applying, it has a side effect. It can cause you allergy. So, before you go for all this, believing all this blindly, of course there are antioxidants which kind of take away your free radicals and make you glow and make you fresh, but then they are just making you feel fresh and glow. They are not meant for treating your pigment, the pigment which you already have. Of course you can go for this green tea and aloe vera. You can take vitamin C. Vitamin C not only does good glow on your skin, it also kind of repairs your collagen. So we can take them, but then they are not going to treat your pigment. Adding Dettol and neem to water while bathing, it cleans your skin and infections. See, it is a very much long aged misconception. It doesn't. In fact, it causes allergic reaction of the whole body and it is very dangerous. Don't do that. Liquid Dettol and neem is a big no. I had fungal infection, got a cream from pharmacist and it worked, but then it reappeared. See, I told you already, there is a big no from taking self-medication. It increases your infection and it has other side effects. Parlor facials versus skin treatments. Now this is very interesting because now these parlors, they claim that they treat all your skin issues and everything. What according to me, I will suggest you, and it's a request as well, that they don't have this scientific basis of the procedures what they are doing. A mild facial, yeah, definitely it gives you a good feeling for 1 day or 2 days, you can get it done, but they are not treatment oriented. They don't target your any specific treatment, and plus it has to, all the treatments, be it peel, be it laser, or be it any kind of transplantation like PRP or anything, it has to be done by a dermatologist and aesthetic physician. Now so I think I'm done with my stuff, so I'll be taking now your questions. So yeah, so I'll go to top. Hello Anup, hello Anup, hello Jay, hello, hi, good evening Aman, good evening Chandresh. Okay, this is hi Gopi Davi. Gopi asks that I never had hair loss, but during lockdown, I can see a lot of hair falling. Any specific reason for hair loss in last 3 weeks only? Okay, so Gopi, I would like to tell you first that since you had never hair loss doesn't mean that you cannot have hair loss now. And if you are having a lot of hair loss now, you must see to it that you are having a good diet. Second, you must know that hair loss occurs after 2 or 3 months of a stress period. So if you didn't have any stress period before, like 2 months or 3 months before, then you can go for a dermatologist and ask for the treatment. And even now, you must consult a dermatologist, call a dermatologist, and get assessed, because there are hormonal reasons as well for the. You must get checked up for your hormone, for your PCOS, for your thyroid level, and then if the telogen effluvium is ruled out, you should go for the treatment. Now the treatment includes your Finasteride, not for females. For females it includes Minoxidil, and after lockdown you can go for the PRP treatments as well. So I think I addressed your question. So now is Zalak. Hi Zalak. Subhash, hello ma'am, hi. So Mojib Ansari, hi, good evening. Shalendra Chaurasia, yes, Vikas Parihar, what to take for receding hairline at age of 44? Okay, so you are 44, so I think this receding hairline would have started a bit earlier, but you would have neglected Vikas, I am pretty sure of that. So if you are getting this receding hairline, this is the time you should not delay. You should go to a dermatologist, and it may be mainly androgenic alopecia, because androgenic alopecia starts from the frontal line. So you should start with your Finasteride, you should start with your Minoxidil, and in between you can go for PRP sessions. And if it is receding more, you can even go for a little bit of hair transplantation if it has receded more. So Amardeep, hi doctor, in maintenance therapy, which is safe and effective, either Minoxidil or serum? Yeah, it's a good question. Serum is for maintenance, it is good, but Minoxidil, if you maintain even after it has been taken care of, your hair fall has been taken care of for a bit longer period, maybe like 6 months or more, it works very good and gives a very good result. And serums are also good, and you can continue with your serums as well for longer time, but Minoxidil is better. So which type of diet is good for hair growth, ma'am? For hair growth we have certain diets like your diet should be rich in protein, your diet should be rich in iron and vitamins and vitamin D. So you can go for a protein-rich diet like the dal and everything. You should go for soya, flaxseed, vitamin D. Normally Indians lack vitamin D. We are deficient in vitamin D, so you can go for vitamin D sachet in that case, which is to be taken 60,000 units per week, like for 8 weeks. And iron-rich food. Yeah, that works pretty well. Then there is Dr. Nikita Kashyap. Hi. Now for washing hair, we should prefer warm water or cold water, ma'am. See, in general, we should avoid hot water in our body, be it your scalp or your skin, because hot water, it does what? And I know I told you about that barrier on your skin, right? So it kind of flex that upper layer and causes more dryness, which makes our skin more prone to infection and loss of the water from your skin. So in that case, you should always prefer cold water or a lukewarm water. Lukewarm water is best, but hot water is never no. By warm, if you mean lukewarm, then it's pretty good. So I think that has addressed your question, Dr. Nikita. Now Ruby Das has asked, suggest my shampoo to prevent hair fall, ma'am. See, I told you, shampoo doesn't cause hair loss, and shampoo doesn't prevent hair loss as well. Shampoo is meant for degreasing your scalp. It's meant for cleaning your scalp. It's nothing to do with the hair root or your growth of your hair. So it's a big myth that shampoo leads to prevention of hair fall. The type of shampoo, yeah, then it depends. That you should not use harsh shampoos, because harsh shampoos can lead to more hair fall. And the pH of the shampoo is very important. It must not contain harsh chemicals. Once you know that, yeah, this shampoo is suiting me and I'm okay with this, you should continue that. But then it's not generalized. Every people have different choice of shampoo, what suits them. The pH and the chemical has to be taken care of. Pranjal More, hi Pranjal, how to remove pimple mark on face. Now, pimple mark is a very common pigmentation that is called acne spots on your face, and why it occurs is when we get acne and we don't treat it, we leave it for get resolution. It leaves pigment, and when we kind of manipulate it or touch it, it causes inflammation over there, and the pigmentation is seen. Now, for this pigment, we have chemical peels and depigmenting agents which work pretty well. Now, the chemical peels for the pigments like trichloroacetic acid and glycolic acid, they work very good, and then we can maintain you on the depigmenting agents like the kojic acid and the phytogens. So I think this has answered the question. Vaibhav Gala. Hi Vaibhav. Vaibhav has asked, Doctor, how can we reduce white hairs? This is a very common question. White hairs have increased a lot nowadays in younger generation as well. See, white hairs has to do with your genetics. First of all, the most important, the cause of white hair is if it is inherited from your family. You cannot do much about that. And if it is, and the second is because of your lifestyle, your lack of exercise in your lifestyle, lack of sleep in your lifestyle, and too much of stress in your lifestyle. So that leads to the graying of hair, increased graying of hair. Now, how to take care of that? There are not much to be done, but there are certain vitamins that you should take, because vitamin B12, vitamin A, vitamin D, the deficiency may lead to increase in white hair. So in that case, you should take pantothenic acid, which is a vitamin. So now the tablets are available. Few serum is there which contains melatonin, or which contains few ingredients which kind of slow down your white hair. So it prevents the further happening of your white hair. So that way, these tablets and few serums you can go for. You can ask me for the brands of the serum. I'm not supposed to, promote any brand here. I can write down in the comment section. Abhinav, hi Abhinav. Abhinav had asked, what can I do to remove my post-acne spots, ma'am? I already told Abhinav, first of all, to reduce your post-acne spots. Once you get an acne, you get it treated. Don't leave it. When you leave it, you get more pigmentation. And second of all, there are peels, there are depigmenting agents which takes care of your post-acne spots pretty well. So for that, you need to contact your dermatologist. Now Suraj Prakash, hi Suraj. He has asked, good evening doctor, please could you let us know about scabies as well in case you have not planned any other session for it. Yeah, I was coming to that, Suraj. Thanks for bringing it here. Because we are locked down, we are at home, and I'm getting a lot of calls for itching as well. This scabies is what? It's kind of severe itching which occurs in evening and night time more. And you get these rashes in between your fingers, around your umbilicus, around your thighs and private areas, and it's kind of, it spreads in the family. So if you are having those kind of rashes, or if you are getting very severe kind of itching in evening, there are chances that you have scabies, and it occurs because of lack of hygiene. You need to wash all your clothes and get it dried in the sun. And permethrin is the lotion which is to be applied overnight, which you can get after consulting the doctor, and you can get in the pharmacy. So this is scabies, and here I would like to address other itching causes which is very common nowadays, people are getting this urticaria. Urticaria is nothing but it can occur because of drug, or it can be a viral manifestation as well, or idiopathic. So the wheals, redness, after you itch, there is a redness which settles down after 2 hours or 3 hours. So that is urticaria. You need anti-allergic treatment for that, antihistaminics. And for scabies, permethrin and ivermectin works best. Permethrin has to be applied all over your body at night, and then left overnight, and then repeated after a week. So Anshu Verma, hi Anshu. Does being diabetic affects in developing pigments? Yeah, pigments are very much hormones related. Be it diabetes or be it thyroid hormone, they do cause pigmentation, because overall they also cause drying of your skin, xerosis. And more is the skin dry, more are the chances of pigmentation. So if you are diabetic, you should apply moisturizers very regularly on your skin so that dryness doesn't occur. And in diabetes, you can also get this behind neck and on your cheek, on your face, you can get this velvety kind of pigmentation, which is very thick kind of pigmentation. And that is called acanthosis nigricans, which needs to be showed to the dermatologist and taken care of. But then yes, you do get pigments in diabetes. Nandini Sharma, hi Nandini, can we use derma roller? No, please no, Nandini. I addressed it already. Derma roller is micro needling, and you cannot do micro needling by your own, because if you do, you don't know how much depth you have to go. You can end up in infection. You can end up getting more pigmentation, after this. So you must get it done in the clinic with the dermatologist. Now, Vaibhav Gala, hi Vaibhav. Doctor, what is the ideal duration of use of Minoxidil from which we can start getting results? Yeah, that is a very good question, because normally people are very much concerned about the use of Minoxidil. They think that it will reverse their hair fall, or it will cause more hair fall, So if you are using Minoxidil, you will see the results maybe not in 2 weeks or 3 weeks, after a month. In 2 weeks or 3 weeks, what you can get is increased hair fall, because your loose hairs, they will fall down and the new hair will come. So for a complete treatment, at least 6 months, and for some results, it may take around a month. So I hope I have answered your question, Vaibhav. Pranjal Moreya again, what's the best way to exfoliate? Okay, this is a very good question, Pranjal. I just missed it. Exfoliation is required, because the dead skin on your dead part or dead layer of your skin needs to be exfoliated, and then after that it should be moisturized for the skin to be healthy and non-aging. Now the dead skin also leads to, if you don't exfoliate, the aging is also pretty quick. So you should exfoliate with vitamin A, that is your tretinoin. You can use retinoids. There are night serums as well, which you should apply on your face. And it should be, night serums are mild, which contains vitamin C and mild vitamin A, which has to be applied daily. But exfoliation you should not do very harshly, and you should mildly do maybe twice a week. That is pretty good. So best way to exfoliate is you kind of don't rub it too much, and don't exfoliate too frequently. Yeah. And after exfoliation, apply a moisturizer or toner. Now, Pasupuleti Balu, hi. Shall we use derma roller at scalp, madam? Yeah, the micro needling does work on your scalp and your hair loss as well. But then again, you should not do it yourself. You should only leave it to the dermatologist to do. What happens is, when you do micro needling and then you do PRP, or when you apply Minoxidil after that, the absorption is better. So it does help in hair loss, but then it should be done by a dermatologist. Yeah, it helps. Now then I'm getting a question. Raj, hi, hi. Sandesh Sangare. For periorbital hypopigmentation, can we use same topical formulation what we apply on face melasma? Which ingredients are safe in periorbital hypopigmentation? Please guide on the same. Now again, Sandesh, you need to first know that your periorbital pigmentation is the cause is what, because your melasma is because of your sun, but your periorbital pigmentation may not be. It may be because of the other cause. So the cream you are applying for the melasma may not work in the periorbital pigmentation as well. But then if it is containing the depigmenting agent, it can work on periorbital pigmentation, but won't be that effective if you don't address the cause of periorbital pigmentation. So the cause of periorbital pigmentation, because of the shadow it is happening, or because of atopy, dryness, because of acanthosis, or it is because of just loss of fat around your eyes. So that those causes has to be addressed and accordingly dealt with. Okay, so I think I've answered your question. Same cream you can apply, but then the thin skin around your orbital area is very thin, so you should first consult a dermatologist before applying anything over there. And even the peels what we do for your facial pigmentation and the peels we do for the periorbital pigmentation, they are very different. For periorbital pigmentation, we use a very milder kind of peel. So yeah, Vadahi Thakur, what is the best sunscreen? Yeah, I just lost it. What is the best sunscreen for combination skin? Yeah, combination skin I just missed. Yes, Vadahi. Well, combination skin is something when you wake up in the morning, you get a lot of oiliness in your central face and dryness at the periphery. So that is the combination skin. Now you have to know what is kind of troubling you more, its dryness or its oiliness, because I have a combination skill and I do get the salicylic or glycol face wash, because my this central portion, it really gets oily at times. So maybe you will need a salicylic or glycolic face wash with less frequency than the oily skin people need, and after that a gel based moisturizer. The moisturizer is a must after that if you are having a combination skin as well. Now Vaibhav Gala, hi Vaibhav again. Doctor, does Minoxidil plus peptide have advantage over only Minoxidil therapy? Do you find it beneficial in clinical practice? Now Vaibhav, yeah, it's a very good question, and there are a lot of studies also present on this comparison between Minoxidil and peptide and the combination. Few studies have got the better results of Minoxidil plus peptide compared to Minoxidil, but then few studies have not got. So the results are very much variable. Peptides do help in the maintenance therapy, and Minoxidil is more for a therapeutic thing. So in my practice, I find Minoxidil always superior. Now I think I have addressed your question. Aman Arya has asked, ma'am, that we can do I'm not getting what you have written. Retention into our skin, as it's having every much important role in aging. I'm not getting your question, Aman. So can you just rewrite your question? Meenakshi just joined. Mojib Ansari. Mojib has asked, good evening, ma'am. Kindly tell us natural remedies for wrinkles. See, there is no natural remedy for wrinkles. Only natural thing existing in this world is you take a proper diet which is balanced, which contains all the proteins, all the vitamins, and all the iron and necessary things. You take good sleep and you have a proper lifestyle which includes exercise and many other things. So that is the only thing natural. If you are referring to some natural or topical application which will kind of make your wrinkles go, for some extent the vitamin C serums and the vitamin C preparations which come, they cause your glow in the skin and collagen remodeling. Vitamin C is the only vitamin I think which causes your collagen remodeling. So that can prevent happening of that can prevent aging. But once you have wrinkles, you should go for the toxins and anti-aging procedures which are very safe. And you see these celebrities, like they are aging and they are aging so gracefully and they look so flawless with no wrinkles and nothing. Actually, most of them, like 99.9% of them, are taking this anti-aging treatments, and that is the reason that they are doing so much. Because Botox, like any botulinum toxin, it not only kind of gets rid of the wrinkles on the face, gets you rid of the wrinkles on the face, but it also kind of smoothens your skin and gives a glowy skin. So you must take anti-aging treatments and tretinoin and all those. You can also take this now very recent hyaluronic acid injections are coming, just below your dermis, which kind of rejuvenates your skin, gives glow, and kind of holds your skin very pumpy, very kind of softens it and gives it a very natural look. So there are a lot of treatments for that, not natural remedies. I'll come back to this Sandesh. For periorbital hyperpigmentation, okay, I think I have dealt with this. So now Mojib, Anup Sharma, ma'am, is there any therapy available to change skin's dark complexion? Okay, I was waiting for this question from long. I was thinking that how come people are not asking this. This is a lot of hype nowadays for, that our society seeks fair complexion and dark complexion since ages it is coming, that we want to look fairer. But guys, this is the time, in this digital time, make sure that you have a healthy and toned and a very good texture of the skin. The overall complexion is beautiful. You just need to make it more glowy and more healthy. You look more confident and beautiful in that. Changing the complexion, there are treatments available, of course. There is this glutathione tablet and glutathione injection, which kind of improves your dark complexion. But then if you take orally, the effects are less. If you take intravenously at high dose, the effects are there. The effects do come, but then it has to be prolonged. It has to be taken for a long time, and there is a lot of glutathione accumulation happening in your body by that. So yeah, there is the treatment is available. Dr. Nikita Kashyap again, very informative session. Thank you, Dr. Nikita. Thanks a lot. Vaidehi Thakur, is a skin whitening pill safe? Again, I know that these questions are going to pour up. See, glutathione injections, there are not much studies, but then if you take antioxidants like vitamin C pills, of course you can take vitamin C pills. You can take it twice or thrice a day, they are safe. But then too much of anything is not safe. You take it in short cycles, don't overdose yourself with that. Even if you're taking glutathione, don't overdose yourself with glutathione. Take it like for 2 months or 3 months and then give a big gap, and then you can restart it. So pills can be taken, they are antioxidants. Tranexamic acid is there, that is also a depigmenting pill that has a very good result on the pigmentation, but that has to be again taken for 2 months or 3 months, not more than that. So just don't overdose yourself. Deepak is saying hi Deepak. Amardeep Kumar, thanks doctor for addressing my query. Yeah, welcome. Niranjana Rai joined. Hi Niranjana. Suparna Datta, ma'am, home remedy for dry skin. Okay, so for dry skin, yeah, coconut oil, it's very good. You can apply coconut oil. It works very good for dry skin if you're not in the reach of moisturizers. But if you are, do take a moisturizer which suits your skin. And but now summer is coming, you can go for the lighter moisturizers as well. So home remedy, see, for dry skin, it's very tricky if you apply anything from the ingredients, and it may lead to allergy. So I won't suggest you that. Go for coconut oil. And in coconut oil as well, don't try to mix anything. Don't try to mix any other ingredients like kapoor or something. It is allergic. So take a plain coconut oil. Deepak, hello doctor, please share your views on glycolic acid combination in treating pigmented skin. It's very good. The effects of glycolic acid is very good in pigmentation. The peels are safe, but it depends again on the depth of your pigmentation, what percentage of glycolic acid actually you require, because there is a big range of glycolic acid. It can be 15% to 70%, 75%. So it's safe if it is done by expert and in a proper percentage, taking care of the depth of your skin. So that is how it works. And the combination, yeah, definitely. Nowadays, for nothing, we have a single treatment. Everything has a combined treatment. We do follow a very much combined approach for your skin and hair treatments. And even for chemical peels, we do combine phenolic acid and TCA and glycolic acid, and the results are very good. So now I have Vaidehi Thakur. Vaidehi has asked, can we put honey on our face every day? Vaidehi, honey is something which was used since ages. Honey has wound healing capacity. It kinds of regenerates your collagen and helps in better skin. Yeah, it can be applied unless and until you are not allergic with it, because we never know that you can be allergic with honey as well. So yeah, in that case we can apply it, but then be sure be cautious. Aman Arya has asked, ma'am, it's water retention I'm asking about. So Aman, you are referring to previous question, I guess. So can you just write down the full question again with the water retention part, because I just don't remember your question. So kindly please repeat your question, okay? Vaibhav Gala, thank you doctor for addressing my query. You are welcome. Sandesh Sangare has told thank you. It was wonderful session. Yeah, welcome Sandesh. Anup Sharma, thank you doctor for resolving my query. Welcome. Thank you doctor. I'm so glad that I'm able to address all the questions. Rajesh, good evening madam. Yeah, good evening. Mohammad Nayaz Ahmed has asked, okay, yeah, good evening. Deepak Yadav, thank you so much doctor for sharing your views on glycolic acid. Yeah, welcome. I'm very much happy to address all questions. So guys, as I was telling you about the advances in skin and hair. So here I'll like to tell more about the advances about the laser therapy, which I just missed. See, laser therapy is what some people will, with pigmentation and a lot of concerns, do want to inquire a lot, but then back of their mind they are scared about that. So for them, I would like to tell that see, lasers, if it is done by a dermatologist, it's very safe, because we have different laser for different indications. If it is for hair loss, we have a different laser. If it is for your pigment, we have a different laser, and for your scars, we have a different laser. And even it depends on the wavelength of your laser, the frequency, the fluence, and everything. So if it is done by proper, dermatologist, it is very safe. You need not be scared about that. Yeah, but there can be complications, like in the very dark skin can be pigmentation, but it is rare, and if it is done properly. So yeah, thank you guys. Thanks everybody for a very I'm very happy that you have good questions, and I hope that I have addressed all your questions. So thank you. Stay safe. Use your lockdown, as I said, and yeah, bye bye.